Hello, Colin Hung here for Healthcare IT Today. I'm coming to you from Nashville, Tennessee, where I am attending the NextGen user group meeting. The NextGen team was kind enough to invite us down to cover their event. The company gave us a free media registration, but we've paid for everything else. This video is not paid for. Last year at this conference, I met Tony Villanueva, the CIO at Neighborhood Health, an FQHC that serves the underserved here in Nashville. Tony and his co-presenters spoke about how they were leveraging mobile technology to better serve the patients in their neighborhood. Well, their work won them an award at this year's UGM. Here is Tony alongside Dr. Bob Murry, Chief Medical Officer at NextGen, to tell us more about it. Let's get to it. Dr. Murry, Tony, welcome back to the program.
Thank you. Thanks for having us.
Thank you.
This is going to be exciting. I'm looking forward to talking to you a little bit more about the award that you won and some of the work you're doing. But maybe just for the benefit of our audience, if each of you can introduce yourself and a little bit about your role at your organizations. Dr. Murry, we'll start with you.
Sure. I'm Dr. Bob Murry, the Chief Medical Officer for NextGen Healthcare. I'm also a practicing family physician in New Jersey.
Yes, and I'm Tony Villanueva, and I serve as CIO for Neighborhood Health and FQHC that is based out of Nashville, Tennessee.
And we are in your hometown where you guys are. We're right here in Nashville at the NextGen UGM. And congratulations, you won an award. Can you tell us a little bit more about that?
Yes, our challenge that was presented to us was in light of achieving what we did in 2019 and either exceeding or at least meeting those goals after the pandemic was the challenge that we had before us for the years 2022 and 2023. What we have found in using data analytics out of the NextGen practice management system, which contains a wealth of knowledge, a wealth of data that can be used to make these decisions and drive insights to our organization, we were able to achieve those goals and actually exceed 2019's unduplicated patients and total encounters for our entire organization.
And Dr. Murry, you were explaining to me what these awards are for. Can you give us a little background about the award itself?
Sure. Yeah, we have multiple types of awards that we love to hear from what clients are doing. So there's awards for clinical care, for financial care, for integrating other products with NextGen, for clinical quality measures, and just kind of innovative use of the products to do what our practices need to do.
Now, Tony, last year we spoke a little bit about some of the fantastic work you're doing with the unhoused and with all the folks in your service area, your community. Tell me a little bit more about that in terms of the work you're doing. Maybe that's changed a little bit over the last year.
Well, yes. Well, with us being a federally qualified health center, our ultimate mission is to be able to provide quality health care without the barriers to the insurance and payment models and all of the other barriers to care that exist out there with our community of Nashville. With all of the growth, the underserved populations, unhoused populations, and just those that are seeking health care, whether it's immigration and other challenges within the organization. Because of the growth of Nashville, we primarily focus to provide quality care, regardless of if you are unhoused all the way to having the most affluent insurance plans. We want to provide a similar experience, healthcare experience to those populations here in Nashville.
And you do a lot of stuff mobile, right? Like, you do a lot of things that are not inside just your clinics.
Yes, outside of our four walls. We have a street medicine team, which we spoke to last year, that serves the community 5 days a week, that they are dispatched and they provide chronic disease management. They provide other types of healthcare services, including behavioral health, and provide that actually out in the community with those via the street medicine program.
And of course, you're leveraging NextGen's mobile to do a lot of that work. Is that right?
Yes. We utilize a mobile product because it does not make sense to carry your traditional laptop or having that traditional equipment when you're going out into the field. So using your standard mobile device to put in your documentation, to look, because a lot of these patients we see multiple times in a year. So you can pull something like a med list or a problems history list and actually know the patient that you're visiting. And we can also send those orders directly from the mobile application to our dispensary and eventually get the medications that are needed for some of those that are out there in the streets as well.
And Dr. Murray, I know this is near and dear to your heart because we spoke about street medicine last time.
Absolutely, yeah.
What are they doing that's really impressive to you?
Well, obviously they're taking care of their community and they're going out to where the people that need that care are. But Tony's being modest, right? They're also very savvy about how they're using the technology. They're taking advantage of it. They're able to, do all of the documentation and everything that needs to be done in the field, in addition to, bringing the blood pressure cuff and the medications and all that stuff, and do everything and just be able to serve that community out in the homeless encampments or by the sides of the road and everything. And they do this, at scale. So it's very impressive. We certainly appreciate everything that they do.
Yes.
Tony, is there anything that's on NextGen's roadmap that you're excited to maybe try or implement in the next year or so?
Yeah. So as all providers know in healthcare, which those are the ones that are delivering the services, it's a very much challenge these days because of regulatory, the documentation burden, which leads to physician burnout when you're trying to provide care and provide quality care and spend time with the patient when you have all of these documentation requirements behind you as well. But very excited about the use case of artificial intelligence, AI, and via a mobile platform with NextGen's Ambient product that it's going to be a game changer and leading to a way to provide that healthcare return to the patient provider relationship that happens in the exam room and less having to focus on a computer screen and just allowing AI to process using natural language processing to process the visit itself, to listen and then chart for the provider at the end of the visit.
Right, it's a lot less work afterwards, right, to try to remember the visit that you just had. And especially if you're doing something mobile, having that right there on an iPad, just recording it and making sure that's all transcribed there. It sounds like it would be very helpful.
Super helpful. I mean, I am practicing family physician, so I've been doing it for a while. It's great for me. I'll never go back. And it's been, quite the buzz here at our user group meeting. One of those, several of the buzzes, but we're up to real scale with that application. Several hundred providers, tens of thousands of visits a month with it, wide variety of specialties, and people are coming up with clever use cases to get the AI to just make them faster. Right? AI is not perfect, but we can use it in such a way that it doesn't have to be perfect. It can still really make people faster. So we're seeing 50% reductions in after hours charting. We're seeing people that used to take 10 days to do their notes and submit, their charges into the computer down to 1 or 2 days, which improves the practice's cash flow. And then everybody's talking about how can they, really get it going and not just like kind of play with it a little bit, but really start to do it at scale. And we anticipate, massive growth.
Now, Tony, I got to ask you this. What is a message you would like to send to our audience and to dispel a myth or a misunderstanding about FQHCs?
We are a fully quality provider of healthcare services. All of our physicians are board certified, and we provide the same exact experience that you would get in a private practice, regardless of what social status you may come into one of our clinics with. And to some extent, we may even be able to provide greater services because it's not just come for a primary care medical appointment. If there are some behavioral health needs or if there's some dental needs, we can provide those services as well. With some of the funding that we do receive, there's some technology provisions that we have to provide as well. So things like virtual visits and being able to provide a patient experience from all the way from the registration. We say we provide services from cradle to death. So we have pediatricians, we have prenatal care, we provide substance misuse disorder services. So again, with being an FQHC, we're able to reach those hard to serve populations, regardless of insurance status.
Yeah, and if I could add to that, Colin, and so I completely agree, right? We've written about this before. I mean, the FQHCs are the country's safety net for healthcare, right? But people think that, oh, well, therefore I shouldn't go to them unless I need a safety net, right? But FQHCs provide amazing quality care, which they can certainly demonstrate. And they can handle folks that are not, no insurance, but, underinsured, or people that have insurance only for part of the year, but not the other part of the year. Or you have plenty of people that have insurance and they choose to go to neighborhood health because it just provides great care. They know the provider. It's just a practice for them that offers just a massive range of services. So, if people are needing any of those services or just curious, maybe they go to probably the NACHC.org
Yes.
website, and that's maybe the best way to find a community health center, a federally qualified health center in your area.
Tony, you've shared a lot of great information with us. Where can people go to learn more about neighborhood care?
Neighborhoodhealthtn.org is our website. And from there, you would find a listing of all the services that we do provide. You can definitely give our contact center a call if you want to discuss anything from, receiving this year's flu shot all the way to getting prenatal care or any of those other types of care models that we've discussed. I would like to say our CEO has a saying about our type of organization is, if you have a pulse, you could come see us at Neighborhood Health.
I love it. I love it. And Dr. Murry, similar question. Where can people go to learn more about NextGen?
Yeah, find all things about NextGen Healthcare at nextgen.com.
Amazing. Awesome. Thank you for both of you for being on the program. It's been great to have you.
Thanks for having us.
Thank you.
I want to thank Dr. Murry and Tony for taking the time to hop on camera with me. I was once again inspired by the work that the team at Neighborhood Health is doing and at NextGen for supporting them in that work. And hey, if you enjoyed this interview, please mash that like button and click subscribe. Also, head on over to healthcareittoday.com where you will find more great content like this. I'm Colin Hung for Healthcare IT Today here in Nashville, Tennessee. Thanks for being here, and I'll catch you on the next video.